It is indeed true that monitoring of the situation is a very important element, stressed also in the joint roadmap towards the lifting of the confinement measures. So it's a very important element of our joint roadmap. Now, when we look at the different methods that are sometimes used on the reporting of death rates, it is true that some countries report death rates in a different ways. There can be different reasons for this. That can be because there's different healthcare capacities, maybe because of different health policies which have been followed. Now, what is important here is that the ECDC is in close collaboration with the networks in the member states to see how these issues of calculation of death rates could be addressed in order to obtain more comparable data in spite of the very difficult and sometimes different circumstances in the member states. The ECDC also provides case definitions for reporting of probable and confirmed cases. It's available on the ECDC website. And it provided guidance on the collection of data on deaths due to the coronavirus. Again, this guidance can be consulted on the website. Finally, the ECDC is also planning to endorse the WHO published guidance on certification of deaths. And this guidance will allow countries to more systematically record and analyze data in this area. So a lot of work is being done with a view to help the member states coming to, I would say, a good measurement of the situation in terms of death rates, for instance. Thank you.
Can I have a follow-up? Thank you for this valid information. I was just wondering, as member states apparently not all fully comply to the various guidances you just mentioned. I mean, do you see any efforts in the future to maybe stress the fact how useful it would be to get them to comply to those guidances in a more coherent way?
But,
Thanks.
Caroline, you need to remember that health is a national competence. And therefore, what the Commission has been doing and will continue to do is to provide as much guidance and encouragement as it can. This is a word that you have been using, and that's exactly the perspective we are in. But ultimately, we have to work with the member state authorities. They have to implement the guidance that is provided. It is not for us to basically impose a methodology on them. Okay, Stéphane, you want to add something to that?
No, you were perfectly clear. Thank you very much. But maybe to say in the context of the Health Security Committee, these issues are also discussed with a view to have a bit of a coordinated approach to things, obviously.
So we're often accused of being heavy-handed in our approaches, but we actually respect the prerogatives of member states, despite the fact that we obviously completely concur with the fact that the more approaches are standardized or harmonized across Europe, coordinated among the member states, the better we will be able to correctly assess the situation overall in Europe and therefore take steps. But we have to respect the institutional framework in which we currently operate. But nothing stops member states from agreeing among themselves to basically move towards ever closer methodologies in terms of assessing the death toll, the victims' methodology in this crisis, the calculation methodology, sorry, of victims in this crisis. Any other questions for Stéphane?